Okay, this lecture is for Chapter 12, Other Endocrine Disorders. Um, Sorry, I close this calendar. There are plenty of other endocrine disorders. When I say other, I include diabetes as an endocrinologic disorder because it is. It is. Um, so things that aren't diabetes: hypothyroidism, hyperthyroidism, anything that comes from the pituitary gland, Addison's disease. Uh, these are things you're going to encounter probably quite frequently, especially the thyroid diseases. Um, this course is not how to diagnose hyper or hypothyroidism, but how to treat it. However, of course, we know that we're going to, when we're suspicious, we're going to look at thyroid stimulating hormone T4 and T3. So be familiar with, high TSH, low T4 means this, high T4, low TSH means that, hypo and hyper. That's fine. That's good for you to know. You need to know that. You'll learn all about that in pathophysiology. That's not going to be quizzable information. Quiz question are probably more like this. Patient, has these lab findings, and I will tell you, rather than say letting you figure it out for yourself, because this course is not pathophysiology, I would say, and these mean that you have diagnosed the patient with hypothyroidism. Which of the following will we begin treatment with? Levothyroxine. And that's not to simplify it too much, but actually it is quite that simple. I treat quite a bit of thyroid disease, mostly hypothyroidism. What will happen is it will be well maintained for some time, and then someone will become even more hypothyroid. We may have to increase their medications. Of course, the flip side of that coin is hyperthyroidism, iatrogenic hyperthyroidism. That's usually going to happen in people who actually still have their thyroid. Now, if we're treating hypothyroidism because someone is athyroid, they've had a thyroidectomy, you probably aren't going to have too much luck making them hyperthyroid. I'm not saying it's impossible, but I've yet to see it. And I've seen some people like that on some big doses of Synthroid. So that's the treatment for hypothyroidism is our synthetic 3,4 thyroxine molecule, and it is the medication levothyroxine. It has a whole range of doses, and you can be familiar with those, but they're going to be based on effect and monitoring the thyroid stimulating hormone and the T4. Okay, so that's pretty simple. Hyperthyroid. These people, of course, and let's go back to hypothyroidism. Remember, the symptoms of both are pretty much given in the name. Hypo, depressed, bradycardia, low energy, things like that. Hyper, increased energy, tachycardia, high potassium, heat intolerance. Okay. Um, Graves' disease. I didn't do that to make fun of anybody. I did that because you're going to remember it from now on. So if anybody accuses me of making fun of anybody, watch out. I'll make fun of you. To treat hyperthyroidism is a little more in depth, okay? So there's definitely a medication approach. We have PTC, I think that's what it's called, or UTC, peptide thiuracil. I'm going to have to look at it because I call it by another name. Y'all are going to make fun of me for being the professor and looking this up. Oh, propylthiouracil. I call it something else. Polythiouracil. Anyways, that of course inhibits T4 synthesis or oxidation of iodine from the thyroid gland, which is what makes T4. Other medications, the methimazole or tapazole, which basically does the same thing, but it suppresses thyroid stimulating hormone. Now, here's the deal. That seems simple enough, but what's causing the hyperthyroidism? So this is probably more for pathophysiology or other things. But if you're treating someone for hyperthyroidism, don't just treat them medically. Get an order for an ultrasound of their thyroid gland, or refer them to a otolaryngologist to do that, because chances are they've got an enlarged thyroid or a thyroid nodule or possibly even thyroid cancer. Okay. Also, with treating hypothyroid or hyperthyroidism, symptom management. Propranolol, it's a beta blocker used to treat tachycardia and blood pressure. Also very effective in treating symptoms of hyperthyroidism. That I do not see in the book. It might be in there, but I'm just going to be honest. I have not read this section cover to cover. It would probably be better if it had pictures, because that's how interesting this is. So, but despite the fact that propranolol for the treatment of hyperthyroidism is not in this book, it could be on the quiz. So remember that. If I say you've got a patient fairly well managed on peptithiuracil and they're still having some tachycardia, what else might you add? Propranolol. Okay. And then let's consider the parathyroid. Parathyroid is involved in management of calcium in the body. So hyperparathyroidism, how are you going to diagnose that? Well, number one, when you check their calcium level in the blood, it's going to be very high. They may also, a lot of times I discover it because someone comes in with a bone fracture that happened way too easily, and they're way too young to be having fractures like that. And all the calcium's not in their bone, it's in the blood. So that can be parathyroidism. And well, sorry, there was something crawling on the floor, and I thought it was a spider, and I hate those things. At any rate, hyperparathyroidism, hypoparathyroidism. So hyper, you're going to see quite a bit of calcium in the blood. Hypo, you're going to see the opposite.